You're sitting in your favorite chair, maybe reading or watching the news, when you feel a strange, heavy pressure right in the center of your chest. It's not a sharp pain, so you tell yourself it's probably just indigestion. You look at the phone, then at the clock. It's late. You don't want to wake up your kids, and you definitely don't want to call an ambulance for a false alarm and end up embarrassed at the hospital. So, you decide to wait. But here is the terrifying truth most people don't realize. For a senior living alone, that single decision to wait and see is often the most dangerous mistake you can make. Every 60 seconds that pass without action, millions of heart muscle cells begin to die, and once they're gone, they never come back. But what if I told you there's a specific sequence of actions, things you can do with your own body and common items in your kitchen, that can actually double your chances of walking out of that hospital fully recovered? In this video, we aren't just talking about calling for help. We are diving into 7 scientifically backed techniques that can keep you conscious, protect your brain, and literally stop a heart attack from becoming a tragedy, including one breathing rhythm that increases oxygen to your heart by 50% and a specific way to use household ice to put your heart into a protective hibernation state. If you live alone, or if you have a loved one who does, the next few minutes could quite literally be the difference between a minor scare and a life-ending event. Stick with me, because the number 1 tip we'll discuss has been shown to improve survival rates by an incredible 65% when done in the first 2 minutes. Look, here's the thing about your body during a heart attack. Every single second is a battle for oxygen. If you're alone, your first goal is simply to stay conscious long enough for help to get to you. This is why being prepared with a specific sequence of actions is so critical for anyone living alone. When specialists examined thousands of heart attack cases, they found that a large portion happened when people were by themselves at home, and seniors over 60 made up most of those cases. These were careful people. They took medication. They went to appointments. Yet, when something felt wrong, the instinct was to wait, not act. This video exists so that moment does not end in tragedy. We are going to reveal the 7 life-saving tips every senior must know about facing a heart emergency while alone, ranked from least to most powerful. These are techniques identified in long-term cardiac studies where seniors who understood them had dramatically higher survival and recovery rates. We are going to go deep into the science of why these work and exactly how to perform them. For anyone who wants to explore the research, the medical sources used for this discussion are grounded in established cardiac emergency protocols. Before we dive in, I want to ask you a quick question. How old are you and where are you watching from today? Have you ever pictured what you might do if something serious happened while you were alone? I'm reading every single comment because we're building a shared heart health journal here. Now, let's move into the first step, because this one changes how you recognize danger when no one else is there to notice it. Number 1, position your body at a 45-degree angle right now to boost heart flow. When chest pain strikes and you suspect you're having a heart attack while alone, the position you put your body in during those first critical moments can literally mean the difference between maintaining consciousness long enough for help or passing out before emergency services arrive. You want to avoid lying completely flat on your back at all costs. I know the instinct might be to lie down, but that can actually make breathing more difficult and increase pressure on your heart. Instead, you need to find a sturdy chair, a couch, or even prop yourself against a wall. This is what specialists call the half-sitting or half-Fowler's position. You want your back supported at approximately a 45-degree angle, your knees slightly bent, and your feet flat. What makes this position so incredibly effective is that it reduces the workload on your heart by using gravity to help blood flow more efficiently, while simultaneously making it easier for your lungs to expand fully. Imagine your heart as a pump that is currently struggling. By sitting at this specific angle, you are reducing the gravitational resistance the heart has to overcome to get oxygenated blood up to your brain. It's a mechanical advantage that ensures every heartbeat you do have left is as productive as possible. When you're sitting at this specific angle, you're giving your body the maximum amount of oxygen possible during a time when every molecule counts. Research has shown that when heart attack victims maintain this specific position, their cardiac output can improve by up to 40% compared to lying flat. This 40% improvement isn't just a number, it is the margin of safety that prevents the brain from losing consciousness. It's why paramedics will often immediately adjust patients into this position the moment they arrive, often before they even start an IV. If you can't get to a chair, even propping yourself against a wall with your knees bent provides similar benefits. The goal is keeping your upper body elevated and your airway open while reducing the gravitational stress on your already struggling heart. Your survival odds increase dramatically when you maintain this position, as it helps prevent the cascade of complications that occur when blood pools in your lungs or when your heart has to work against gravity to maintain circulation to your brain. Think of it as opening the floodgates for oxygen. Number 2. Start coughing forcefully every 2 seconds to maintain heart rhythm. The cough CPR technique is one of the most powerful yet often misunderstood methods you can use when experiencing certain types of heart rhythm problems while alone. This technique involves taking a deep breath and then coughing forcefully and repeatedly every 2 to 3 seconds. This creates pressure changes in your chest that can help maintain blood flow to your brain and potentially help restore a normal heart rhythm during specific types of arrhythmias that might otherwise cause you to lose consciousness within seconds. Imagine your heart isn't pumping effectively on its own. Each forceful cough creates a sudden spike in chest pressure, up to 100 millimeters of mercury, that compresses the heart between your breastbone and spine. It literally forces blood out to your brain and vital organs, acting like a form of self-administered CPR that can keep you conscious for those crucial extra minutes until the ambulance arrives. This is not just a standard cough. It needs to be a deep, productive cough that comes from the very bottom of your lungs. The science here is based on the idea of the thoracic pump. When you cough, the pressure inside your chest cavity rises sharply. This pressure is transmitted directly to the heart and the major blood vessels. It's like using your lungs as a pair of hands to squeeze your heart for you. The timing here is everything. You need to start the technique as soon as you feel lightheaded or notice irregular heartbeats. Waiting until you're about to lose consciousness makes it much less effective, with research showing effectiveness drops by 70% once severe lightheadedness sets in. To do it correctly, sit upright in that 45-degree position, take a deep breath that fills your lungs completely to at least 80% capacity, and then cough as hard and deeply as you can, as if you're trying to clear thick mucus from deep in your chest, or forcing out the very last bit of air from your lungs. You need to repeat this cycle continuously, without any breaks. Breathe deeply. Cough forcefully. Again, breathe deeply. Cough forcefully. This rhythmic pressure can actually sustain life for several minutes during an episode of ventricular fibrillation or cardiac arrest. This isn't a replacement for calling 911, but it's a supplementary action that keeps blood flowing to your brain when every second matters. Number 3. Chew 325 mg of aspirin immediately for 30 seconds before swallowing. That humble bottle of aspirin sitting in your medicine cabinet could be the most powerful weapon you have against a heart attack when you're alone. Taking aspirin within the first hour of symptoms can reduce mortality by up to 23% and limit the extent of heart muscle damage. The reason it works so well is that most cardiac events are caused by blood clots forming in your coronary arteries. These clots are made of platelets that stick together like a biological glue, cutting off oxygen. Aspirin immediately goes to work thinning your blood and preventing these clots from growing larger or new ones from forming by blocking the production of thromboxane A2 in your platelets. It effectively deactivates the stickiness of the platelets, but there's a very specific way you need to take it to maximize its effectiveness. You should chew a full-dose 325 mg tablet rather than swallowing it whole. Chewing breaks down the medication and allows it to enter your bloodstream through the lining of your mouth and your stomach up to 50% faster, reaching therapeutic levels in your blood in just 5 minutes instead of 15. In a heart attack, 10 minutes is an eternity. It is the difference between minor heart damage and a major infarction. The moment you suspect trouble, after calling for help, immediately chew that aspirin thoroughly for at least 30 seconds before swallowing it with a small amount of water. It's absolutely crucial that you use regular, uncoated aspirin. Enteric-coated or extended-release versions are designed to slow down absorption to protect your stomach, which is exactly what you don't want in an emergency. You want that medication in your system immediately. Many people keep aspirin in multiple locations, their nightstand, the kitchen, their wallet, to ensure it's always within reach. It works at the molecular level to make your blood more slippery, allowing it to flow past partial blockages that might otherwise completely cut off oxygen to your heart. This allows at least some oxygen to reach the threatened muscle, buying the doctors time to perform more advanced procedures later. Number 4. Apply ice packs to your neck, armpits, and groin immediately. This might sound surprising, but applying cold to specific areas of your body during a heart attack can significantly reduce the amount of permanent damage to your heart muscle by up to 38%. This works through a process called therapeutic cooling or hypothermia. Think about it this way. When you cool a cell, its biological clock slows down. It doesn't need as much oxygen to stay alive. By slowing down your cellular metabolism, you're reducing your heart's demand for oxygen. It essentially puts your cardiac cells into a protective hibernation state that preserves them while blood flow is compromised. The application is surprisingly simple. You want to apply ice packs, cold wet towels, or even bags of frozen vegetables to the areas where major arteries run close to the skin surface, the sides of your neck, your armpits, and your groin. These locations are strategic because they provide the most efficient cooling of blood traveling directly to your heart and brain. As the cooled blood circulates back into the heart, it lowers the temperature of the heart muscle itself by a few critical degrees. Research from major cardiac centers has found that targeted cooling can reduce the metabolic demands of your vital organs, buying you more time. You should wrap the cold source in a thin cloth to prevent skin damage and apply it for about 10 minutes at a time. This isn't about cooling your whole body. That would cause shivering, which actually increases metabolic demands by 40% and makes the heart work harder. It's about targeted cooling of those major blood vessels. It prevents the flood of harmful chemicals, known as free radicals, that normally occur during a heart attack, protecting your heart from further injury when blood flow is eventually restored by doctors. This cold shield is one of the most advanced ways a person can protect themselves before they even get to the hospital. Number 5. Breathe in for 4 counts through your nose and out for 8 through pursed lips. The way you breathe during a crisis can dramatically impact your survival. When pain and panic hit, the natural urge is to hyperventilate, taking rapid, shallow breaths. This is a survival mechanism, but it's a flawed one during a heart attack. Rapid breathing actually decreases oxygen delivery by 30% because it doesn't allow enough time for oxygen to move into the blood, and it can trigger dangerous heart rhythms. Instead, you need to use a specific breathing technique that can increase oxygen delivery to your heart by up to 50%. Inhale slowly and deeply through your nose for a count of 4, allowing your belly to expand. This is diaphragmatic breathing, and it ensures you're using your full lung capacity, filling those lower air sacs that often stay empty during shallow breaths. Then, exhale through pursed lips, as if you're whistling or blowing out a candle, for a count of 8. This pursed lip exhalation creates a slight back pressure of about 5/73 of water in your airways. This back pressure keeps your air sacs open longer, which is critical because it gives the oxygen more time to cross the membrane into your bloodstream. This breathing pattern also activates your parasympathetic nervous system through vagal nerve stimulation. This is your body's rest and digest system, and it helps counteract the surge of stress hormones like adrenaline and cortisol that can cause the heart to beat too fast or irregularly. By focusing on making your exhale exactly twice as long as your inhale, you are physically forcing your body to stabilize its rhythm. It reduces the workload on your heart by 20% while ensuring your vital organs get the fuel they need to survive until the paramedics arrive. It's a way to keep your cool when everything else feels out of control. Number 6. Call 911 within 5 minutes and track your golden hour precisely. The concept of the golden hour is the most critical factor in determining your quality of life after a heart attack. This refers to the first 60 minutes after symptoms begin. Every single minute of delay results in progressively more heart muscle death. Your heart muscle cells can only survive about 20 minutes without adequate oxygen before they begin dying irreversibly. Once they die, they are replaced by scar tissue that cannot contract, leading to congestive heart failure later in life. This is why you must call for help within the first 5 minutes. Don't call a neighbor. Don't call a family member to check in. Call emergency services immediately. Note the exact time your symptoms started, as doctors will use this to determine if treatments like thrombolytics or emergency angioplasty are still viable. These treatments are often time-sensitive and cannot be given if too much time has passed. While you wait, use any strength you have to unlock your front door and turn on the outside lights. If you have your medications nearby, put them in a bag so you can show them to the paramedics. Research shows that patients who arrive by ambulance receive specialized care, like ECGs and cardiac medications, significantly faster than those who arrive by private vehicle. In fact, an ambulance arrival can save an average of 30 minutes in the door-to-balloon time at the hospital. Those extra minutes saved can mean the difference between losing 10% versus 40% of your heart muscle. Your quality of life for the next 20 years depends on what you do in these 60 minutes. Number 7. Take nitroglycerin under your tongue within 2 minutes of chest pain. This is perhaps the most powerful tool for those with known cardiac risk factors. Nitroglycerin is a vasodilator, meaning it works by rapidly dilating your coronary arteries, often within 30 seconds. It releases nitric oxide into your system, which relaxes the smooth muscle in the artery walls. This opens up alternative pathways for oxygen-rich blood to reach areas of the heart that are being starved. It also reduces your heart's overall workload by dilating blood vessels throughout your body, dropping the pressure your heart has to pump against by 10 to 15 millimeters of mercury. This lowers the heart's oxygen demand by about 25% immediately. If you have risk factors like high blood pressure, diabetes, or a family history of heart problems, you should speak with a professional about having this medication on hand. It comes in tiny tablets or a spray that you place directly under your tongue, where it enters the bloodstream almost instantly through the sublingual vessels. The standard protocol is to take 1 dose at the first sign of pain while sitting down. If the pain persists after 5 minutes, you can take subsequent doses every 5 minutes, up to 3 doses, while help is on the way. You should never exceed 3 doses in 15 minutes. It's also important to replace your supply every 6 months, as it is very sensitive to light and heat and loses about 30% of its potency over that time. Having this medication ready and knowing how to use it could add years to your life by preserving critical heart function during that essential window when every second of improved blood flow counts toward your survival. This is the ultimate tool for stopping a heart attack before it can do permanent damage. Surviving a heart attack when you're alone isn't about being lucky. It's about being prepared and knowing exactly how to react. We've covered a lot today, from the way you sit and breathe to the medications you should have within reach. These 7 techniques work together as a complete survival system. Each one is designed to buy you more time, protect your heart muscle, and keep you conscious until professional help can take over. I know it can be a lot to remember, but even knowing just 1 or 2 of these could change your outcome. Look, here's the thing. Most people ignore the signs until it's too late. But since you've watched this far, you're already ahead of the curve. You're taking your health seriously, and that's exactly what it takes to stay independent and active. If this information changed how you think about your heart health, hit subscribe because I break down health science like this every week. Real research, no fluff, just useful stuff that helps you stay in control of your life. Thank you so much for watching, and I'll see you in the next video. You're sitting in your favorite chair, maybe reading or watching the news, when you feel a strange, heavy pressure right in the center of your chest.